Hey guys, welcome back to our second lesson today on recovery strategies. So today we're going to be looking at hydrotherapy. So if you haven't heard of hydrotherapy before, hydrotherapy is any therapy that's involving the use of water. And so we're going to be talking about things like contrast bathing, which is going between hot and cold water or baths. Cryotherapy, so you guys probably would have heard of ice baths before, like this little dog down here having a great old ice bath down there. Thermotherapy, when we're using heat, so probably use of spas. And the last type of therapy for hydrotherapy is the use of pool and beaches when there's full submersion of the person. So the first one we're going to talk about is contrast water therapy. So contrast water therapy involves subjecting the body to alternate periods of hot and cold water. So pretty much we're going to jump in a hot thing like a spa, and then you might go in something cold, which is more like a plunge pool. To do this properly, you might want to have the correct facilities where they might be down at the local swimming pool where you actually have these, or the professional sports clubs would actually have these on site as well. So it's based on alternating vascular vasodilation and vasoconstriction, promoting an increase in blood flow. So firstly, we'll talk about blood flow. So blood flow is important around the body because when our blood flows around our body, it goes from our heart to our muscles that are working. Firstly, it delivers more oxygen to our working muscles. But then, apart from that, it's also removing waste. So some of the main products that remove waste might include hydrogen ions. So we'll look at the benefits later on, but that's why we want to focus on our blood flow. To do that, we have these two words over here, vasodilation and vasoconstriction. So pretty much that's talking about what's happening to our blood vessels in our body. Vasodilation means that those blood vessels are getting larger. So when we get into the hot water, our blood vessels will actually open up and promote more blood flow. And when it's vasoconstriction, when we're in the cold water, our blood vessels will shrink down smaller, and so that constant dilation and constriction is going to promote more blood flow around the body. So as I said, we're using spas to promote muscle massage. Cold water immersion, increase the compression of the muscle, so pushing down, getting that vasoconstriction. We want to try and do these in full submersion. You could do it in a shower, but it's by making it hot and cold. But it is best if you can use a pool. If you guys want to try this at home, probably the shower is going to be the place to do it. The benefits of it. So these are important things we need to look at. So it's going to increase the removal of waste products. So as I said, associated with the blood flow, we can remove more waste, as well as increase the supply of oxygen. And so having more oxygen is going to help to remove those waste, restore those PC stores, and also to help to heal our body faster. It's going to help to decrease inflammation or edema. So in other words, our swelling of our joints. It's going to increase the circulation, blood flow, also the range of motion of those joints, and the perception of recovery. Pretty much what that's saying is you'll feel better. It might not actually do anything at times, but psychologically you'll feel like you're more recovered. The last one is it's going to decrease the likelihood or severity of delayed onset of muscle soreness, or we refer to it as DOMS. I went for a 7K run the other day. It's the furthest I've run probably in 20 years. And I didn't feel too bad afterwards, but the next 3 days, I definitely had this DOMS where I had a delayed onset of muscle soreness. I could hardly move. My back was so sore. So trying to do these kind of hydrotherapies to decrease our DOMS is a great strategy to prevent the soreness and also to get back to our performance levels higher and faster. Okay, so a few rules for contrast water therapy. Firstly, we shouldn't do it if we've recently got any bruising or any other injuries. It's going to promote more blood flows. It's going to make it worse. Obviously, if you've got open wounds, not a good idea to be going in the water. A history of heart disease. If you've got a history of heart disease, it can actually be a risk factor for you to actually have a heart attack or any other cardiovascular injuries. And if you have a virus as well. If we look down the bottom here, we can see some ideas of how we could do it. So if you're at home and you want to try this out, you might want to look at the shower protocol. So what can we do in the shower? So for 30 to 60 seconds, warm to hot water. Make sure it's not boiling. You don't want to burn yourself. So you do 30 to 60 seconds of hot water. Then you do 30 to 60 seconds of cold water. That should be cold water. So you want to repeat that 5 times here. So that could be one way of doing it. The ideal though is if you have, like at the local pool, they might have a spa, and next to it they might have one of those cold plunge pools. So you might do 2 minutes in the spa, a pretty hot temperature, 38 to 39 degrees, and then you'll go jump in that plunge pool for 1 minute at 12 to 14 degrees again. Repeat that. Hopefully by doing that you're going to promote more blood flow with a vasoconstriction, vasodilation to promote blood flow, increase oxygen, remove those waste products. The next one I'm sure you've all heard of is cryotherapy, or it's when we use cold. So you might use ice packs, but the best way to do this is actually cold water immersion. You guys probably heard of this more as ice baths. You can see it doesn't have to always be an ice bath. This guy's grabbed a wheelie bin, got lots of water in there, chucked in plenty of ice, and I can tell you that will be pretty dang cold. So how does this help us? What's the benefit? Well, it decreases acute inflammation. Acute just means a short-term inflammation. So it's going to prevent the swelling of our joints or any areas that we might have injured. It's also going to reduce the perception of pain. So you might have got a corky or something. So someone's knee might have hit your quadricep. You might be really sore, and it can kind of help to reduce the pain that you've got there. So next up, it lessens the impact of dehydration. So it does that by the fact that you're going to be decreasing your core temperature, which means you're going to be sweating less. You're going to have to require less blood to go to the surface of your body, to your skin, so you're not going to be as red, won't have as much water leaving you. Decrease core and tissues, that's temperatures to assist homeostasis. That should be one dot point, I apologise. Reduces muscle spasms and also decreases blood flow. So before with the contrast bathing, we were saying it's good to increase blood flow, but for this one, we might want to decrease blood flow. So situations we might want to use this is if we've had those soft tissue injuries, straight after that, we probably want to decrease the blood flow so it doesn't get any worse. We're trying to prevent any additional swelling to occur. The next one is thermotherapy, where we're looking at using heat as a way of promoting our improvements. So this is going to be done usually with soft tissue injuries, but it's going to be happening after about 48 hours. Okay, if we do it too early, it's going to be promoting that swelling, which isn't going to be good for us. So to do this, we want to try and look at spas and heated pools. If you think about Aquanation, where we do our swimming carnivals, they've got a heated pool there, which is made perfectly for the hydrotherapy of thermotherapy. The benefit of this is, again, it's going to increase blood flow. So there's going to be increased blood flow going to our muscles, promotes the removal of waste, reduces muscle spasms, increased muscle elasticity, and joints range of motion. So think about this when you warm up for an activity. You can actually have a greater flexibility after you've done that warm up as well. Increases neural transmission, which means the neurons from our brain, or the electrons from our brain to our muscles, can move more efficiently, and also contributes to the feeling of relaxation. I'm sure we've all been in a spa before, and we all feel grouse afterwards, feel much more relaxed. So the protocol for heat therapy is pretty easy. Have a shower, jump in the spa for 10 to 15 minutes, and make sure you're drinking water, stretching, sit in front of the jet massage. Life is pretty good with this type of therapy. The last one we're going to look at is pool and beach sessions. So you've probably seen the AFL footy clubs. So if you look down the bottom, see that on the news at night on a Monday after the games on Sundays. You see the whole team kind of walking around down the beaches at the bay. So the idea of this is to not just to go out and have a team bonding time together, but the idea is to immerse. So go in the water. As a part of that, it acts as a compression. So when you're in the water, the actual pressure of the water actually pushes down on your muscles, and especially in salt water. So if they're going down to the beach, that pressure on the body is going to help to promote the blood flow and also reduce the swelling. So it's helping to reduce that muscle swelling. It's also going to increase the blood flow. Again, increasing blood flow means we've got more oxygen and we're going to remove more waste. This one's also a really good way of decreasing that delayed onset of muscle soreness, or DOMS. So that's it for today, guys. I hope you guys are going well. Make sure you just go to OneNote now, look through all those instructions, answer the questions, and we'll see you next time.